So it seems like, whenever we talk about people in nursing homes, it's always a matter of medical and physical health. We don't really talk much about their mental health. Um, but you got to figure, when someone's, you know, they lost a lot of things. Maybe they've lost a spouse in the home, they lost their physical abilities, that, they're going to be depressed and feel like they don't have a sense of control, over their world or environment. And I want to do stuff that helps them feel a little more that way, And sometimes the only thing they control in their space is it's called a bedside table. That's a little table that goes over the bed, or it can go close to them if they're in a chair, and they can use that. And I think I'd encourage all families to just think about the number of things that can be put in on a bedside table for your loved one, Maybe it's a favorite book, favorite snacks, favorite drinks, some kind of digital device that tells them the date, the time, or an emergency weather radio, a police scanner radio, notepads, pencils, some grooming supplies, a cell phone, writing material. I'm just throwing stuff out. Notepads, just anything that gives them a plant that they can care for. Just anything that they can have control of themselves. The more things that they can have control of, the more they feel like it's not just them and just random things happen to them, So that's just a little suggestion. And for other people, especially like if you've got somebody, a loved one that's confused, they sell these little digital frames that you can load pictures in, scan pictures in, and then maybe even you can put some of their favorite songs, And, if they have, Alzheimer's, you can ask staff to, present this to them once or twice a day, and they can just have a moment seeing these old pictures, getting back in touch with some of the things that really meant a lot to them, and hearing those songs. I just think it would do a world of good, especially if you have somebody that tends to be anxious or upset and they're confused. I just think that would really be helpful for people. So those are just little quality of life recommendations I'd make, that if you could do that, that might help them feel better. Okay, that's it. Short and sweet. If you liked it, thumb up it, and share it with friends, and get more information at www.nursinghomeRisk.com. Got a couple more to kick out. I hope my cell phone will make it. Okay.